We are delighted that you have joined us today, this Friday, April 19th. Today you're in for a wonderful lineup of speakers, of experts, and we're just delighted to have this opportunity to have a conversation from different sources of knowledge. And we hope that at the end of this session, you will be becoming more fluent in other areas, in other languages of disciplines, because we hope to have people from the community of environmental health, climate change, air pollution, as well as people from the NCDs, from the non-communicable diseases area. So let me introduce myself. I am Gloria Giraldo. I am the advisor for non-communicable diseases and mental health for the PAHO Subregional Coordination Program for the Caribbean. And this morning, I am delighted to greet you on behalf of Mr. Dean Chambliss, the director of our PAHO Subregional Coordination Program in the Caribbean, who is very sorry he couldn't join us. However, he's given full support to this very important webinar. Therefore, let me start with a few words so that we can get started and get into the substance of our webinar today. This webinar is a first in many respects. It's an event organized by all levels of the organization because we have the PAHO's Climate Change and Environmental Determinants Unit in the new Department of Social and Environmental Determinants of Health, Equity, along with our partners from WHO's Air Quality, Energy, and Health Unit. And I'm also very excited to be part of this collaboration with the World Heart Federation. And of course, in coordination with the office I represent, which is the Subregional Coordination Program for the Caribbean. We are bringing new information at the intersections of fields that may not always be seen working together. However, moving forward, this is the only way to go, this interprogrammatic approach. Today, the diverse expertise and audiences from environmental, health and climate change, as well as medical healthcare providers, are coming together to tackle the impact of air quality on non-communicable diseases. You may ask why this is a priority now. For some that are newcomers to this conversation, worldwide, each year, 6.7 million deaths are attributable to ambient and indoor air pollution. About 89% of these deaths occur in low and middle income countries. According to WHO, since 2018, air pollution was classified as the second leading cause of death from NCDs after tobacco smoking. We are painfully aware that NCDs, principally cardiovascular diseases, cancer, diabetes, and chronic respiratory diseases, are the leading causes of death. They're responsible for approximately 80% of all deaths in the region of the Americas. And cardiovascular disease accounted for 2 million lives lost, totaling a third of all deaths in the region. And in the Caribbean, more people die from CVDs than from any other cause. In the Americas, the burden of disease of air pollution is linked to nearly 370,000 deaths every year. This includes mortality associated with ambient outdoor air pollution. This is linked to the use of fossil fuels and poor controls in industry, transportation, and power generation. Even in households, air pollution is produced by lighting, heating, cooking with inefficient stoves, and the use of polluting fuels such as wood, coal, charcoal, crop waste, and kerosene. Clearly, reducing air pollution can significantly impact the burden of NCDs and result in multiple co-benefits for health. As part of the Health, Environment, and Climate Change Cooperation Agenda for the Americas and PAHO's Disease Elimination Initiative, PAHO is continuously focusing on decreasing the burden of disease from air pollution in the region, strengthening health sector capacity and leadership to respond to air pollution, and implementing tools for integrated action on health, environment, and climate change. We are currently working in the Caribbean through our partners and funded by the European Union to increase national capacities to mitigate climate change and tackle air pollution and protect public health in Caribbean countries. This includes the use of air pollution health impact assessment tools, the estimation of benefits of its reduction. These projects are being carried out in Trinidad and Tobago and Jamaica. Additionally, the development of integrated action plans on health, air quality, and climate change are in process in Central America, the Dominican Republic, and Trinidad and Tobago. Therefore, this webinar session, in partnership with World Heart Federation and WHO, aims to bridge a fundamental gap, informing the health community about the health impacts of air pollution and the opportunities to address it as an NCD risk factor. We are sure this cooperative initiative will highlight the synergies that can be created in assessing, monitoring, and reducing the impact of air quality on the health of the peoples of the Caribbean and the region. Therefore, I thank you, and I'm delighted now to introduce Dr. Mark Miller. Dr. Mark Miller is a reader working in the Center for Cardiovascular Science at the University of Edinburgh. Dr. Miller's research investigates the health effects of air pollution, particularly the biology underlying how particles in vehicle exhaust can affect the cardiovascular system. Mark is the chair of the World Heart Federation Air Pollution Expert Group and is an expert member of the UK Governmental Advisory Committee on the medical effects of air pollution. We welcome Dr. Mark Miller for his remarks.
Good morning, everyone, and also good afternoon and good evening if you're joining us from outside the PAHO region as well. Let me just share my screen very quickly. Let me try to share my screen quickly. Hopefully it'll come up in a second. Can everyone see that? Unfortunately, I can't see it myself. Okay, let me just try that again. Apologies. There we go. So once again, thank you very much. So as Gloria has, thank you very much, Gloria, for introducing me. I'm Mark Miller from the University of Edinburgh in the United Kingdom, and I'm here today in my role of the chair of the World Heart Federation Air Pollution and Climate Change Expert Group. And really, I think Gloria has introduced this subject far more nicely than I can, but I did want to extend my welcome and just present a few more of those statistics once again. But first of all, thank you on behalf of PAHO, WHF and WHO to let me welcome you to this webinar. We're really grateful for so many people joining us, and hopefully you will share our enthusiasm on what we believe is a really crucial issue for health. And that's for everyone in the world, no matter where you are, whether you're young, old, whether you're healthy, or whether you're a patient with a disease. I think it's fair to say now that awareness on the health effects of air pollution is definitely growing. It's at the top of the public health agenda. It's really nearing the top of the political agenda in many countries. But it's a subject that really still needs our attention, and it needs so urgently, because what we must bear in mind is that air pollution is a risk factor for disease, but it's a preventable risk factor for ill health. It's one we can do something about. So Gloria has mentioned a few of their subjects, a few of these statistics in her introduction. I would just do the same because it really shows you just what an important issue air pollution is. It's an underappreciated risk factor for health. So depending on which figures you look at, pollution is the fourth or the sixth greatest risk factor for all-cause mortality. And if we're focusing on cardiovascular disease, over 3 million premature deaths from cardiovascular disease are attributed to air pollution, and that's every single year. And when we extend this to all-cause mortality, it's actually really over 7 million deaths. And even this is a gross underestimation because this is just one pollutant, not the whole mixture that we're exposed to each day. And overall, this accounts for 1 in 8 deaths. 1 in 8 deaths across the world are due to air pollution, and that's more than a fifth, more than 20% of all cardiovascular deaths. You'll see at the corner of the slide, I've just put some a schematic, an infographic that's from the WHF. Please visit their web pages if you want to see some more similarly shocking statistics than this. I'm going to skip very quickly over this slide. This slide is really just to show you some of the work that the WHF has done with the World Health Organization. On the left, we have a policy brief that was produced by the WHF, which covers the basic background, the data in the area, and also makes recommendations for different stakeholders. And on the right hand of this slide, this is a screenshot from the website of the WHO looking at their toolkit for air pollution and capacity building and learning. And this is something we'll discuss today, but please do visit the web pages. Those are excellent resources on them. And this is our agenda today. I won't run through it just because I'm conscious I'm taking up the time and we really want to get into this subject. What I will just say is we have a session for questions and answers midway through the conversation and also at the end as well. So we will just go through this as we come to it. I just want to give you one last slide, and that's please do join in the conversation. If you have any questions during the talks, please do write them in the Q&A and section of Zoom, and we'll try to get around to them at the session we do. And when it comes to the general discussion, please do participate. We have a huge range of different individuals here from different backgrounds, and we're hoping we can have some lively and thoughtful discussions there. So with that, I think it just remains for me to say please do enjoy the webinar, and I will hand over to Carolyn for the first presentation. Thank you, everyone.
Thank you, Mark. Sharing my screen now. Just let me know if you can.
It's coming, not in presentation mode yet.
Can you see it now?
Yes.
Perfect. Okay. Good morning, everyone. Good afternoon. It's a pleasure to be here to talk about air pollution and non-communicable diseases in the Caribbean. So when we think about the Caribbean, we think about clear skies and blue beaches, and there are a lot of beautiful beaches in the Caribbean. But there's also something else there too. In the Caribbean, we have industries. We have oil industries. We have mining industries. We also have transportation. We have vehicles, heavy-duty vehicles. We have high sulfur content fuel. And during the dry season, we have wildfires and also sometimes open burning of waste. Now imagine what happens to your body when you inhale this toxic soup of pollutants. Air pollution doesn't stop just in your lungs. It goes to every part of your body. It affects almost every organ, from your heart to your brain and to your blood. The impact of air pollution is so systemic that it's actually the second leading cause of deaths from non-communicable diseases. So it really shouldn't surprise us when we see headlines like air pollution kills millions every year, like a pandemic in slow motion. But what is interesting, though, is that the top 4 causes of deaths globally is ischemic heart disease, stroke, chronic obstructive pulmonary disease, and lower respiratory infections. These are the same 4 diseases that you can get when exposed to air pollution. And of the 14 million lives that we lose because of environmental pollution, half of those lives could be saved if we were to reduce our air pollution levels. So I think we could all agree that air pollution is a public health crisis, but the WHO air quality guidelines can actually help governments protect their citizens. And in 2021, we updated these air quality guidelines based on an increase in both the quality and the quantity of evidence. And we now know that there is much more harmful effects of air pollution at much lower levels than we previously thought. So a lot of our air quality guidelines have decreased. So here we're looking at air quality guidelines for particles as well as for gases. And you can see that for each of these pollutants, we have 2 sets of averaging times, annual values and 24-hour values. And these correspond to long-term and short-term exposure to different health risks. Now, however, not all pollutants do we have quantitative values for, because there's insufficient evidence. And some of these pollutants, such as black carbon, ultrafine particles, and sand and dust storms, there we have good practice statements to help countries manage their exposure. I think it's important at this point to highlight that the air quality guidelines they don't specify end goals that define success or failure, but rather they are meant to guide countries into showing them what clean air and how that can impact your health. And I think it's important to highlight the interim targets. The interim targets allow us to it gives us almost like a stepwise values to go towards the air quality guidelines. And any reduction we have in air pollution is a step in the right direction. So we know air pollution is a public health crisis, and because of that, the WHO is monitoring air pollution in order for us to track progress on this. And to this end, we collect national data from countries on the proportion of the population that's using clean fuels and technologies. We also collect annual concentrations on fine particulate matter. And this data is then combined into global models for us to estimate the global burden of disease, what is the mortality from air pollution. Now, because it's important for us to have country level data when we're tracking progress, we also develop a lot of guidance documents and tools to help countries develop their capacity in order for us to have more data when reporting these SDG indicators. Okay, so let's start now looking at what the air pollution actually looks like across the Caribbean and in particular the PAHO region. So here we're looking at annual average fine particulate matter concentrations across the decade from 2010 to 2019, and representing concentrations for the 4 subregions in PAHO: Central America, South America, the Caribbean, and North America. And we can see that all the regions are doing a really good job with it in between the WHO's interim target 2 and the air quality guideline. And for most of the regions, we see a steady decline in the air pollution across the decade. But in the Caribbean, we see that it's fairly constant around interim target 4. So let's zone into the Caribbean. Let's look at how these concentrations vary across the different islands in 2019. And when we look at the different islands, we can see that there's a lot of variability. Some of the countries are approaching interim target 3. So most of them are hovering around interim target 4. And you have some of the countries actually approaching the WHO air quality guideline, which is wonderful. Now you notice that there are 4 of these triangles that are dark. And what that's identifying, these are the countries that are collecting air pollution data at ground level, and they're sharing this data with us. And I want to highlight this because it's really important to have local monitoring of air pollution that then feeds into our global models, because this gives us really accurate estimates then. So as more countries are monitoring data, more countries are reporting, we can get an even better picture of what the air pollution looks like. So now let's see what happens when the population inhales these fine particulate matter. So here we're presenting the number of deaths for every 100,000 persons, and this mortality rate is for ambient air pollution across the Caribbean. And we can see that about 5 of the countries have higher mortality rates than the regional average in PAHO, and about 5 of the other countries, and majority of the countries, are fairly close to that. So we could see the impact of ambient air pollution is fairly significant in the Caribbean region. But what about household air pollution? How is that impacting the population? And here we can see that some countries, the mortality rate has actually doubled. So some Caribbean islands are also being burdened not just by ambient air pollution, but also by the household air pollution. So we know that ambient and household air pollution could be a significant problem for the Caribbean, but how does that, what diseases, how do we see this manifesting in our population? So let's take a look at the 5 specific causes for mortality that we focus on. So within the Caribbean, we can see the greatest proportion of deaths are coming from non-communicable diseases, such as heart disease, followed by stroke. Similarly, in PAHO, we see that heart disease accounts for more than 50% of the deaths in PAHO. And I think here it's important for us to highlight that more than 70% of the deaths are coming from air pollution exposure that comes from NCDs, non-communicable diseases. And it's not just in the lungs, but also in your heart and your brain. So this really shows the pervasive nature of air pollution. But the good news is that when you decrease your air pollution levels, you can also decrease your mortality rates. And if we look at the regional trend in PAHO across the decade, we can see a steady decline in air pollution level that has also has led to a steady decline in mortality rates. What this tells me is that clean air and better health is possible, but we all have a part to play in that, whether we are in the WHO, in academia, in the government, and the health workers. Every action that we take can bring us closer to a breath of fresh air. Thank you for your attention. If you have any questions, happy to answer it.
Thank you so much, Caroline. And we are doing very well in our transitions. I do want to highlight that Dr. Caroline Scherzing, who just gave us this wonderful presentation, is the consultant in the Department of Environmental Climate Change and Health at the World Health Organization. And we're delighted. That was an amazing overview and really brings home why we are here today. Thank you so much. Now I have the pleasure to introduce you to Dr. Samantha Pegoraro. She is a physician currently working as a technical officer in the Air Quality and Health Unit at WHO in Geneva, where she's responsible for activities such as today's building the capacity of the health workforce on air pollution and health. Samantha, please.
Thank you. Thank you very much, Gloria. I hope you can hear me, and good morning, good afternoon, good evening, everybody, to all the participants. I see there is a very large group here gathered. So let me share my screen. I think you can see it. Okay, so again, welcome, and in my presentation, I will present the WHO Air Pollution and Health Training Toolkit as part of the building the capacity of the health workforce on air pollution and health. But let's start from why. So let's start from asking ourselves why the need for equipping the health sector with competencies to deal with air pollution. The first one, as it was already mentioned, is that air pollution is one of the main risk factors for health, accounting for almost 7 million deaths every year worldwide. And it is now included as one of the main risk factors for non-communicable diseases as part of the 5x5 agenda. At the same time, currently, health curricula, as well as disease guideline and disease risk reduction guidelines, are not sufficiently addressing air pollution. And it's within the WHO's role and mandate to indeed equip the health sector and health workforce with air pollution competencies. This was mentioned as part of the WHO resolution back in 2015, as part of the roadmap for an enhanced global response to the adverse health effect of air pollution, which came in 2016, and also as part of the commitments and WHO's own commitment at the first WHO Global Conference on Air Pollution and Health in 2018. So what is the Air Pollution and Health Training Toolkit? It is a set of materials that is designed to enable health workers, both those who are caregivers and working in clinical contexts, but also in public health fields, to understand and communicate the health risks of air pollution and identify the risk reduction measures, to use the health argument, as we were saying before, to advocate for clean air and clean air solution and intervention and promote a multi-sectorial collaboration, but also to train and educate peers and colleagues, and as well as engaging with the community. This toolkit, as it's about to be released, we will pilot a portion of it today, has been developed in collaboration with many experts from government agencies, WHO collaborating centers, non-state actors, which includes medical and environmental health associations, as well as academic institutions. So here you can see a snapshot of the toolkit, which includes in-person and online learning experiences. On the left of the slide, you see a snapshot of the training materials, which include training modules, a train-the-trainer manual, clinical case scenarios on air pollution and health, as well as materials for community engagement. Then a second part is the online learning opportunities, an open WHO course, an online course, and a work that is in development in collaboration with the WHO Academy, as well as an online interactive education opportunity. The material has been piloted back in 2022 in Ghana, with health professionals being represented from all the regions of the country. And indeed, on the occasion of the UN Clean Air Day in September 2023, we launched the first part of this toolkit, which is the open WHO online course, which I will present to you in the next slides. And again, the toolkit will be released soon this year. So the online course examines the main health impacts of air pollution and which role health workers can play to protect and promote people's health. It's an open and freely accessible course, which takes around 4 hours to be completed. It's self-paced, and it includes some training units, videos with experts, focus and recap sections, reading materials, some case studies, as well as some interactive exercises as part of the platform, and final key messages. It also enables users to get a WHO certificate of achievement. In this slide, you can see the QR code for enrolling in the course. That is indeed, as I was saying, it's published and available. And as of today, we have more than 9,000 enrollees, including 1,800 health professionals, 3,000 students, as well as 500 representatives of ministries of health, just to give you a little bit of a snapshot of the type of audience that is enrolling in the course. And of course, we welcome you to check the QR code and enroll in it. Just to briefly mention the course content, I won't go into the details, also given time constraints, but it's made up of 4 modules. The first one is addressing mainly outdoor ambient air pollution. The second module deals with household air pollution. The third module on the health effects of air pollution, and the fourth module puts together all the information included in the first 3 modules and address the role of health workers and what can be done in the community with patients, but also to advocate for clean air solutions. Now moving to a short presentation of the other training materials. The toolkit includes several training modules, which will be PowerPoint presentation, downloadable and freely accessible to everybody. It includes introductory modules, but also disease-specific modules. As you see, some of these modules were used to build the online course, which can be considered as a sort of a short version of the full toolkit. So introductory modules on ambient, household, health effects, a module on air quality index, what it is and how it can be used, a module on clean energy access at the household level, and the role of health workers that I was mentioning before. And some of the disease-specific modules will go into non-communicable diseases, mainly cardiovascular disease is the module that we will pilot today with Dr. Rajesh Vedantan, and module then on respiratory system, children's health, and a perspective on brain and mental health perspective. To complement the use of these modules and to enable, as one of the aim of this training toolkit, then enable health workers to train others and train colleagues and peers in their communities, is the Train the Trainers manual, which presents the principles of becoming a trainer, how to organize and deliver online or in-person workshops and educational opportunities with health workers, and of course, how to use the training modules, how to use the slide deck, how to use the online course, and indeed facilitate the organization and executions of the workshops. Just as a final slide, as part of the toolkit, we are developing clinical case scenarios on air pollution and health, with the intent to improve the reasoning and decision-making skills of health workers, to include and start including more air pollution as one of the risk factors for the onset of diseases or progression of symptoms. It's an interactive tool that will be available as part of the WHO Academy learning course. And it is these clinical case scenarios were developed by an expert group set by WHO. Each case scenario addresses an air pollution specific health outcomes in higher risk groups such as older people, pregnant women, and children. And it presents context of both ambient and household air pollution exposure. So I think I can stop here, and thanks a lot for listening. For any questions, there is the chat, or you can ask and raise your hand. And over to you, Gloria. Thank you.
Thank you very much, Dr. Pecoraro. This is a wonderful overview of these amazing resources. And as a newcomer, I come from the NCDs area of work. This is such an opportunity for me as well to get trained, as many of my colleagues, in this new relatively newer topic, as we often we see patients, we see communities, we see populations, we see the consequences, and now this is a wonderful opportunity. And now let us get into today's really, I would say, one of the most exciting parts of today is that we will actually have a chance to be part of seeing a module from this from the resources that were just described. And for that, we are very pleased to introduce Dr. Please forgive me, I've been practicing Rajesh Vedantan, and he will pronounce his name as it should be. Apologies for that. He's the director of the Section for Global Health in the Institute of Excellence in Health Equity at the New York University Grossman School of Medicine. He's associate professor with tenure in the departments of population health, medicine, cardiology. He is a physician scientist who is internationally recognized for his contributions to improving global cardiovascular health and health equity. Please, let's take the session.
Great, thank you so much, Gloria, and great to be part of this session and conversation. Thank you so much for the invitation. So as Gloria mentioned, my name is Rajesh Vedantan, coming from NYU Grossman School of Medicine, and very happy to be presenting to you today the module on air pollution and cardiovascular diseases. As we have seen, actually, there's been a lot of really wonderful background information already provided in general, as well as specific to the Caribbean. So some of the introductory slides are overlapping with those, with that content, and so I'll try and go through those relatively quickly. The learning objectives for this module are the following: to describe the global burden of cardiovascular disease attributable to air pollution, to explain the current paradigm shift from an individual to environmental risk factors for cardiovascular disease, to be able to list the mechanisms of pollution attributable cardiovascular disease, to recognize patients at elevated risk of pollution attributable cardiovascular disease, and to apply community and individual level interventions. These are all the acronyms that you may see in the context of the following slides. And the outline here in detail, but basically looking at burden, as I mentioned, mechanisms, risk assessment, and then finally interventions. So a global perspective on air pollution and health. The big picture really is that, as has been mentioned already, air pollution kills around 7 million people every year. If anything, that's actually an underestimate. As I've been working in this field for the past decade, every year, every update of the Global Burden of Disease study actually increases that number. And my anticipation is that that will continue to increase as we recognize the disease burden related to air pollution. Over 9 out of 10 people in the world live in areas where air pollution is exceeding WHO global air quality guidelines. And thank you so much to the previous presenter showing specific Caribbean data here, which also indicates that despite the fact that at an absolute level, actually the Caribbean is doing quite a bit better than other regions of the world, still several of the countries and several of the local communities are experiencing or exposed to suboptimal elevated air, levels of air pollution. Over 2.3 billion people still rely on energy sources that are polluting for cooking, therefore exposing themselves to harmful indoor air or household air pollution. And a quarter of global deaths are due to environmental risk factors. When you look at the global burden of disease and look at the sort of different risk factors, actually particulate matter or air pollution is number 4 currently, just behind blood pressure, smoking, and high fasting glucose. And again, as I mentioned, my prediction is that this will continue to increase over time. Nothing to celebrate, but something to obviously be concerned about and to try and respond to as much as possible. When we look at the population attributable fraction from ambient air pollution, and you look at the different disease entities pictured here, air pollution contributes a significant amount to each of these different entities: lung cancer, stroke, heart disease, and lung disease. But in particular, as I'm a cardiologist by clinical training myself, and today focused on cardiovascular disease, you can see that a significant portion of cardiovascular disease, including heart disease and stroke, are attributable to air pollution. When we look here at age standardized mortality rates around the world, you can see here region of the Americas, and within the region of the Americas is the Caribbean. But really, it's a fairly complicated graph or figure here. But I think the important things are sort of columns C and D throughout, which are cardiovascular ischemic heart disease, and C and E, which are ischemic heart disease and stroke, as well as total. And what you can see, even in the Americas, including the Caribbean, that ischemic heart disease and stroke contribute significantly to total mortality attributable to air pollution. And that around the world, the total death rates are actually quite significant. Again, if anything, actually somewhat better in the region of the Americas, including the Caribbean, but there still is improvement that can be made, as has been demonstrated and described previously. One of the very important things that actually happened was that the World Health Organization actually included air pollution as a top risk factor for non-communicable diseases. So the prior framework was, quote unquote, the 4x4 framework. And just a few years ago, they actually expanded this to 5x5 and included air pollution here in recognition of the significant contribution and burden of air pollution on all non-communicable diseases. And very importantly, they also included mental health as the fifth condition, which is very important in and of itself, but also actually related to air pollution and climate change, more broadly speaking as well. So now moving from exposure to illness, some of the health effects of air pollution, and this is the sort of like classic sort of pyramid that we think about in terms of health effects. You see the sort of quote unquote tip of the iceberg or top of the pyramid with respect to premature morbidity and mortality. But really, there are subclinical effects that obviously are affecting a much larger proportion of the population. And that's very important to recognize, especially for thinking about sort of life course exposure to air pollution and other environmental factors, and really thinking about health promotion and trying to protect children and vulnerable groups. This is the some of the cool image sort of related effects for the slide. Just to move on, the routes of human exposure to air pollution, obviously inhalation is the most sort of common and frequently thought about. But to be honest with you, air pollution can be enter the sort of body, or the body can be exposed to air pollution through all of these different mechanisms or routes as well: dermal absorption, ocular exposure through the eyes, ingestion as well. And then when thinking about how we should thinking about how we should sort of conceptualize exposure to air pollution, we always think about exposure, but also dose, which is the actual number of pollutants that enter the body through the exposure pathway. It's related obviously to both concentration of that pollutant as well as duration of time exposed. And so very important to sort of think of all of those factors. So different particles with different sizes tend to both get ingested or exposed at different levels of the body. And also with respect to the respiratory tract specifically, different sized particles can migrate to different parts of the respiratory system. And as you can see here, in particular, the smaller particles make their way all the way down to the sort of final alveolar level sort of physiology and anatomy of the respiratory tract in contact with the microcirculation and ultimately the systemic circulation of the body as well. And so even these ultrafine particles, as you can see here, making their way across the sort of alveolar space into the circulation. The other important consideration with respect to specific chemicals and gases is that depending on solubility, the sort of damage and the sort of absorption and the sort of location of the toxicity will be sort of chemical and solubility specific, as detailed here for sulfur dioxide all the way down to carbon monoxide as well. Some of the ways that air pollution can affect organs in terms of the actual pathophysiology and pathology include trigger of oxidative stress, dysregulation of the immune system, pro-inflammatory pathways, even potentially epigenetic regulation. And this is where it's very important to think about even exposure to pregnant women, the sort of children in utero or early childhood, et cetera, who may then subsequently down the life course have effects of exposure during a critical time window early in life. When thinking about general pathological mechanisms of PM2.5, this is obviously a fairly complicated slide here. Basically, the idea being that PM2.5 is able to interact with and activate local cells, including a variety of different cell types, macrophages, dendritic cells, alveolar cells, all of which can then contribute to various types of cellular and histological pathophysiology, membranes, lipids, ultimately endothelial dysfunction, et cetera, causing a bunch of the cardiovascular effects that we see. And here are the sort of macro level health effects that we see at the different organ levels. And so, respiratory, obviously, cardiovascular, which is the focus of the presentation today, but other disease entities and body systems as well: lung cancer, diabetes, cataracts, premature birth, skin aging, neurodevelopment, mental health, as I've mentioned. Thinking now specifically of the effects of air pollution on cardiovascular health, this is a clinical case study that we had written up in the context of our work in the Afro region. The sort of prevalence of household air pollution due to the use of biomass fuels is very high. Some of this content may or may not be strictly relevant to some of the geographies represented by the audience members today, but I think still a significant issue in many, many parts of the world, including in portions of the Caribbean and other regions of the Americas as well. So just to read this quickly, Mrs. Mutai is a 72-year-old woman with a history of hypertension and diabetes mellitus who visits Dr. Chebet in Nairobi for a regular health checkup. The doctor is testing a new approach for screening and protecting patients from the harmful cardiovascular effects of air pollution. Mrs. Mutai is identified as a patient at elevated risk of pollution-related cardiovascular events, given her age and multiple cardiac risk factors. A brief risk assessment is performed. Mrs. Mutai cooks her meals using an indoor wood burning stove and commutes across town on a public bus. Dr. Chebet locates Mrs. Mutai's home on a publicly available pollution map and learns that the average daily outdoor pollutant concentrations in her neighborhood are 61 micrograms per cubic meter. Dr. Chebet calculates that these various exposures impart an elevated risk of ischemic heart disease and stroke. And so this type of risk assessment, which all of us in cardiology, preventive cardiology, general medicine traditionally do using traditional risk factors such as lipids, diabetes, hypertension, smoking status, et cetera, can actually now be applied to air pollution, both ambient and household air pollution. That's the sort of main message that we're trying to get across with the story, and I'll go over a little bit of how that assessment can be done in detail subsequently in this presentation. Some of the evidence related to the relationship between PM2.5 and different gases with respect to ischemic heart disease, really the most sort of substantial and strongest evidence base is related to PM2.5 as a broad category, linking exposures to a variety of different cardiovascular entities, but including specifically ischemic heart disease, and then also ischemic stroke as well. But beyond ischemic heart disease and stroke, a variety of different studies have actually linked PM2.5 exposure and various gaseous pollutant exposures also to heart failure and even dysrhythmias such as atrial fibrillation as well, and hypertension also as a risk factor being definitely related to air pollution exposure as well. Finally, thinking about other sort of studies that have shown links to other cardiovascular endpoints or risk factors, atherosclerosis, diabetes. And so really, in sum, the idea is that cardiovascular disease at several different levels and according to several different disease entities and mechanisms, really susceptible to the harmful effects of air pollution exposure. Now, thinking about this individual risk assessment, what we have traditionally, or what we have sort of proposed to the community, is to think about quote unquote susceptible populations as well as vulnerable or highly exposed populations. And so susceptible populations means those who have potential predisposition to increase the relative risk of adverse outcomes due to a specific level of air pollution exposure. So as I mentioned before, children, the elderly, different life stages such as pregnancy, individuals with pre-existing comorbidities such as cardiovascular and other risk factors are all individuals who are susceptible to a specific level of air pollution exposure. Then we have individuals who are quote unquote either vulnerable or what we like to call also highly exposed. And these are individuals who, due to the conditions in which they live, work, and play, are individuals as well as communities who are highly exposed to air pollution. So, unfortunately, those who generally have lower socioeconomic status, certain occupations, obviously, again, dependent on living conditions. And then if you don't have access to clean energy in the home or are dependent on solid fuel use for cooking and heating, those are the individuals who are going to be highly exposed to both ambient and household air pollution. So thinking about individual risk assessment, again, the idea is to really sort of think of an analogous way to be empowered as a clinician to be able to, in the context of your clinical encounter, do the same type of risk assessment related to air pollution as we do all routinely for other risk factors, as I mentioned, such as hypertension, smoking, diabetes, weight, diet, etc. And the idea is to really sort of use this assessment alongside those other standard questions. And so I guess my main goal today really is to empower all of us as clinicians and individual health workers and health professionals to be able to incorporate response to air pollution in the context of individual encounters. And so we came up with a clinical screening tool, very simple, consisting really of just 3 questions, looking at both household air pollution as well as ambient or outdoor air pollution, really asking about whether household solid fuels are used and whether they live or work near an urban industrial center or near heavy traffic. And again, just being able to use that information as a clinician in the context of your clinical encounter. Actually, one of the big things that happened actually recently was that the International Classification of Diseases actually now came up with a new code for exposure to air pollution. And in fact, you know, I think recently, as people probably are aware in the news, there are now a handful of individuals, you know, that are actually sort of have been determined to be have died as a result of exposure to air pollution. So I think sort of a big potential tidal wave in the context of thinking about the importance of responding to the burden of air pollution on health. Now, thinking about the role of the health sector, really the idea is, as I mentioned before, already to think about the micro level and patients in the clinical context, but really thinking about our roles as health professionals at both the meso and the macro level, thinking about how we can actually sort of promote resilience in the community, and also how we can advocate at the level of policy and governmental and regulatory decision-making that happens at a much larger level. And here again, just to say that the role of healthcare workers can extend beyond the clinic. When we think about individual behavioral modification advice, you know, here are some of the examples of behavioral modifications, thinking about recommendations for physical activity. Really, we do recommend that physical activity should be promoted, but it can be done potentially at times or at places where local exposure is going to be less, and that can be something that can be recommended. So here we say exercise away, or at times when air pollution exposure will be less. Really thinking about using air quality data where available, and increasingly those are becoming more available over time. Following advice related to wildfires, which is again one of the sort of major issues related to climate change and air pollution that is evolving at this time. And so, et cetera, many other sort of recommendations that are just very practical that we can be empowered to discuss with our patients in the clinical encounter. Here are some of the, again, sort of general principles that we can guide our patients on. So reducing the amount of time spent close to the pollution source. So again, really thinking about the sort of dose of exposure related to concentration of the pollutant and time spent being exposed. And so really thinking about time spent, thinking about better ventilation, and obviously thinking about cleaner fuels, or potentially even leapfrogging to electrical stoves so that you don't have exposure to the gaseous compounds. And then at the level of population, really sort of engaging with policymakers, regulators, the decision makers on issues that affect entire communities and populations. So regulations and the sort of regulatory bodies, but also really thinking from a research or scientific perspective on data sharing. And very happy to, again, have heard today many of the efforts by the WHO to improve data collection and data sharing amongst different bodies. You know, it is a truism that the only thing that gets changed is the thing that gets measured. And I think very important for us to continue that, and really thinking about our health promotion efforts, again, at all levels, individuals, communities, and at much larger collections of populations as well. And then there are several different campaigns all around the world. This is one called the Breathe Life campaign. Some of the website details are here. really trying to improve, sort of air pollution and air quality at various places around the world. Here pictured Greater Cairo, and providing information about unsafe levels all the way down to safe levels. I think these types of campaigns are very important to also promote, support, get involved with, etc. Another one here called the Breathe Life, Breathe London campaign. And again, many of these have been successfully advocated for, and also from a technical expertise perspective, provided input into by health professionals involved at the intersection of air pollution and health. And very important for us to, I think, consider being involved in those different ways as well. Really thinking about air quality indices. And again, as I mentioned, there are an increasing number of air quality monitors and systems that are now made available. Actually, even if you use Google Maps, you can actually sort of click on the button that sort of indicates local air quality levels. And that has been useful, to be honest with you, even for me personally on an individual level basis. And I think can be useful again to you and to your patients as well. And basically all these different text boxes are basically saying that the healthcare workers such as ourselves can use this when counseling patients and individuals. Again, many different air quality indices that are available, many of them now color-coded, such as this. This is from the US Air Quality Index, really sort of being able to provide a visual representation of quote-unquote safe to risky air quality in your particular geography or neighborhood. The challenge is that currently medical and health professional education really has limited exposure to content related to air pollution, climate change, et cetera. And so very important for us as, again, health professionals invested in and concerned about this issue to really advocate for incorporating this content into our health professional educational curricula. Disease guidelines also frequently don't mention air pollution and health, but I'm happy to say that that is starting to change as well over time. Really important for us as health professionals to disseminate the knowledge. So this type of sort of seminar that we're doing today is an example of that. Important for all of us to sort of educate ourselves, then disseminate that knowledge to others, whether it's within our local community or professional community. And here are just some very specific examples of ways in which you can get involved in the public arena, which can actually have quite a significant impact as well. So going back to that clinical case study, as I mentioned, from Kenya, the question here is, what could Dr. Chebet do? And I'm hoping that what I've been able to share with you today is that we can be empowered as individual clinicians and as individual health professionals to be able to discuss with our patient on the cardiovascular risks from air pollution, connecting them potentially with an organization to provide cleaner fuels for cooking and heating. Again, connecting potentially to local community-based services and opportunities related to air pollution monitoring, and really sort of counseling on just very practical advice about avoiding exercising at particular times of days or at particular geographies, et cetera, to the extent possible and feasible, obviously, for that individual. But just to say that we should really feel empowered to be able to not feel like this is too big of a problem for us to be able to even deal with on a day-to-day basis. So the key messages here, that air pollution affects cardiovascular health of nearly everyone, with the greatest burden falling on low and middle income countries, that addressing pollution attributable cardiovascular disease really does require a paradigm shift away from individual traditional risks to also include environmental risk factors. Most of the evidence related to the pathophysiology and management of cardiovascular disease is attributable to particulate matter, but this data evidence base is increasing over time, that there is significant evidence about the relationship between air pollution, ischemic heart disease, and stroke, but as I mentioned, other cardiovascular entities as well, heart failure, atrial fibrillation, hypertension, et cetera. And that there's growing evidence to support interventions. And I think this is important, that we don't feel hopeless, that we can actually feel empowered to try and make a difference, both at the micro level and the macro level. And that's, I think, sort of what is trying to be highlighted here in this final bullet, really be empowered both at the individual level as well as in our respective communities. Just wish to acknowledge all of the contributors, authors, reviewers to this presentation and content that I've presented here today. And thank you so much.
Thank you so much, Dr. Vedant. This has been fascinating. Again, we get this opportunity throughout today. It takes us a little deeper and a little deeper and a little deeper into understanding this intricate relationship of air pollution and cardiovascular disease. So thank you very much. And we are so excited that we've had continuously 100 participants from many, many geographies. So we thank all the participants for having joined perfectly on time and remaining with us throughout today's webinar. Now I'd like to pass on the mic to Dr. Mark Miller, whom you've met at the beginning of the webinar, and he will be moderating our next panel. Please, Dr. Miller.
Hello again, thank you to everyone, and first of all, thank you to all the speakers. I mean, these have been lovely, clear presentations, and I think what comes across to me really is we are really sort of beginning to understand just how serious the issue of air pollution is. It's not just a niche interest, it's something that is really affecting huge amounts of the population, no matter where you are in the world, and all the talks have shared some really striking figures. And I think even most of the talks, and particularly Rajesh as well, have shown that the science is really strong behind some of our understanding of how air pollution affects health. We know the biological mechanisms. We have a good idea about which are the most harmful air pollutants. So I think it's great we're now moving to a stage where we can really develop the interventions to tackle air pollution, but also try and improve the awareness in all different sectors, whether that's policymakers, whether that's the general public, whether that's medical doctors, and passing on that conversation. So it's great to see these initiatives really taking place, and we're getting to practical advice and practical changes that will improve this issue. Anyway, you didn't come here to listen to me. I'm hoping that we have some questions here. So I think a few of the panelists have tried to address some of the questions that have been typed into the question and answer section of Zoom. So hopefully there's answers to them which we can discuss. I will prioritise anybody though who is feeling particularly brave and would like to ask a question in person. So do feel free to raise your hand. I will give you just a moment to do that, and then while you do that, maybe we could just come back to some of the questions that have been asked in the chat so far. So there was a question that came on early on, really asking for advice as what needs to be the role of governments and local authorities to reduce the risk of air pollution, and particularly heart disease. So thank you for that question. I put in my thoughts, which as usual are never concise, and that's really that we need to be getting governments and local authorities to work together. And there's big issues here, like meeting the WHO guidelines on the different air pollutants to non-fossil fuel proliferation treaties, but also smaller things as well. We need local authorities to be able to implement interventions. So if that is, for example, a low emission zone in a city, this needs to be run effectively, it needs to be monitored effectively. If this is improving people's lifestyles to try and sort of minimise their risks of cardiovascular disease in general, and of course the risks for the health effects of air pollution are similar to some of those, you know, what needs to be done to implement those? I think maybe I could ask Carolyn. That question was also directed at you. Carolyn, would you like to provide your thoughts on that just before I move on to the other questions?
Thanks, Mark. No, I think you answered. To complement that, I think it's really just important to recognize that, you know, air pollution is something, the mortality and the health risks associated can be prevented. And there are sectoral interventions, but it's important for us to understand, first of all, what sectors are the dominant sources of air pollution in your country. And once you have that, and a part of that is monitoring, but once you know what that is, you could then target that through policy. So whether it's waste burning, whether it's transportation, you know, you just need to understand that. And then once you have that knowledge, really, that's the first step there. Thanks, Mark.
That's great. Okay, I see we have a question. Shania Wilson has raised her hand. I'm hoping that feel free to try and turn on your mic. I'm hoping you can ask that directly to everyone. Can we do that? I'm just asking the organisers. I take it the audience are able to ask questions live at this point.
Yes, it should be possible. Okay.
Okay. Shania, do you want to ask?
Hi, good morning. Can you hear me?
Yes, good morning. We can hear you now. Thank you.
Okay. So I am from Guyana, South America, the Environmental Protection Agency over here. So earlier I heard in the presentation we talked about data, air quality data that is being used to inform some of the statistics that were mentioned. And mention was made that ground level monitoring is also included when to improve the accuracy of the data and the projections. So my question is, how can we provide that data to you as the Environmental Protection Agency for Guyana? And is there any standardized methodology for collecting the data to maintain consistency and accuracy of the data? We have quite a few data. I am the climate data modeling, monitoring, and analyst here at the EPA. So I have 2 years worth of data on ambient air quality in specific areas in Guyana, and I do have data on the ground within our industrial zones, agricultural zones, and residential zones. So I want to know how can we contribute to that, because it would be great to contribute to it. We want to see Guyana on the map. We want to see data from Guyana. So yeah.
Okay, which one of our panelists would like to answer that first?
I can go there, Mark. That's Shania, that's wonderful to hear. I'm going to actually put an email address in the chat for you. So usually the routine that what we normally do is we reach out to your statistics office, and they share the data with us, but they're supposed to reach out to you as a focal point. But sometimes, that it happens a lot that we have that miscommunication. So there is a template that you can actually upload the data to, and then you can send it to us. So I'm going to send you an email, and once you can reach out to us, we will respond to you and share that template. So we always, this is wonderful. It's always important. It's always good to know that there's more data out there, and the more that we know what's happening in the Caribbean, really, it's wonderful. To answer your second question, yes, there are quite a few reference standards with respect to how to monitor air pollution. I'm also going to share with you something else too in the chat. But next week, Monday, we have a webinar, WHO webinar, that focuses really on how to monitor air pollution. So looking at the different methods. But the US EPA, as well as the European office, they also have different standards on how to where you cite your instruments, how you collect your data. So there's a lot of detailed information to ensure that the reference grade measurements are standardized. So we can certainly share all of that with you, but I will put stuff in the chat, and please do follow up with us via the email. Thank you.
Thank you so
Caroline.
much.
That's great. Rajesh, would you like to follow up on that question?
Yeah, just to say that's exciting and great that you have those data available. Obviously, I'll defer to Carolyn and others from WHO and PAHO. But just to offer that, we and our group, and I'm sure Mark and his group have, looked at the sort of association between air pollution and cardiovascular health outcomes in several countries of the world. And so, maybe we can think about doing it specific for Guyana, or potentially like the sort of countries as a conglomerate as well. So it's just happy to be part of that conversation going forward, if that's helpful.
Yeah, I think that's great. And it is a really topical issue. I think the one other thing to add to that, which is not really answering your question, but I think it's important to highlight, is that it needs to be a lot more in the way of citizen science projects as well. Now, these tend to happen on a smaller scale with low-cost monitors, which are not really at the level and sort of have the quality of the data that can be integrated with either government stations or non-reference monitors, but they are really powerful as well. And it's especially the case where you may have interventions, and I'll come back to low emission zone as well, where you can have citizen science projects, for example, in schools, in local authorities, and collect some wonderful data at lots of different locations that couldn't really be done on a larger research scale where we have to use much more expensive equipment. So these are for different purposes, but you know, these different levels of data are all really useful for saying, you know, how effective air pollution strategies are, and then at the other end of the level, being able to feed into epidemiological studies that then show how these things affect health. And often it's the health effects which really will get policymakers listening to you as well.
And Mark, just to complement on what you were saying, indeed, there are also initiatives from health professionals gathering data using local census in hospitals, also to advocate for clean air in the workplace. And this is also interesting, I think, as a perspective from what health workers could do for clean air. There was a question with regards to what a nurse could do, a midwife could do, and these type of beyond the interaction with patients and individuals, these type of activities linked to citizen science, I think they are also very powerful for bringing the health argument in the context of air pollution.
Yes, I think that's true. That's a very, very good point as well. And indoor air pollution is something which I can expect a lot. We will hear a lot more about. We hear a lot about it in low and middle income countries at the moment, but actually there's a huge effort going to look at indoor air pollution, even quite modern buildings as well. And I think the regulation will soon follow that. Yes, Karen, please do, Shanna.
Yes. I don't know if there's anyone on the call from our health sector here in Guyana, but we are a bit behind with, bridging the gap between indoor and outdoor air quality and our health system. So I'm hoping that somebody's on the call that can further follow up with you on how we can get moving along, that developmental scale to capture air quality in our health sector, because we do have quite a lot of cases with persons with asthma, persons working in industrial zones and whatnot, but not necessarily targeted like how we do our health system. If you go to see the doctor for something going on with your lungs, little to no research is being done to like pin the point source, like earlier was being described in the case study, where the doctor would look at the map and look at the air quality in the area where the person is residing and kind of try to figure out the source. That does not happen here. It's kind of like we deal with healthcare by clipping the branches instead of uprooting the entire tree. So that's the gap where we're at right now. So I'm hoping someone from our health system is on the on this webinar and would reach out, and you guys can help them to bridge that gap and improve our healthcare system.
Thank you for that. That's a great point, and please do. This could lead to very wide-ranging discussions. Please do, everybody in the chat, if you can help follow up on this point, leave some messages there. I'll just move on to Juan Castillo. I'm hoping you're going to tell me that I've not run too over time, and this is actually an air pollution question.
No. It's actually a comment to Shania, a response to Shania comment on technical cooperation on air quality and health in Guyana. Actually, we recently have a mission to Guyana where we were trying to discuss different topics to advance technical cooperation of PAHO in the Americas. Air pollution is being discussed at this time, and the invitation also was sent to Ministries of Health and Environment. So we might have some people from the Ministry of Health here as well. But as you mentioned, like Guyana has a good opportunity also to advance on clean household energy, especially taking advantage of the energy transition that the country is experiencing at this time. And we are eager to foster this technical cooperation, and we are already in conversations with the PAHO office in Guyana. So hopefully we will update you on this soon, Shania. We are also excited to hear that there is new data available, and I think either by submitting that information to WHO, we will make sure to circle back to PAHO so we can try to put together a technical cooperation agenda on this topic, or to incorporate this into a technical cooperation agenda. Over.
Thank you, Juan. That sounds wonderful. That's great. Okay, I think we still have another 7 minutes to go. So Rajesh is an absolutely amazing speaker, not only for the quality of his presentation, but the fact he can actually get over so much information so coherently and still give us an extra 10 minutes for questions and answers. So we do still have a few more minutes, so please do put your hand up and ask a question. Just while I wait to see if any hands emerge, there is a question in the chat, and it's a big topic in the field. Shamil, I'm going to pronounce this wrong, I do apologise, is it Yerushalami? Has asked the question, what is the connection between air pollution and mental health? I'm sure lots of people have lots of things to say on that. Does any of our panelists want to comment about air pollution and mental health to start us off?
Thanks. Yeah, I can reply to that. Maybe, or Rajesh, you want to go before?
Maybe I'll just take a quick moment, Samantha, if you don't mind, and then I actually have to excuse myself for another competing obligation. But just to say that actually, just like we have a growing amount of data connecting air pollution to cardiovascular health outcomes, there is a significant, already substantial body of evidence, but also growing body of evidence linking air pollution, again, climate change more broadly speaking, and mental health outcomes as well. It's an incredibly important effect related to the exposure to air pollution and the challenges and hazards of climate change. I also just wish to add one other thing, which is that the World Health Organization, in partnership with the World Economic Forum a decade ago, published anticipated costs of different non-communicable disease entities over the next 3 decades. Number one was mental health, actually, $16 trillion of sort of macroeconomic costs related to premature morbidity, mortality, and loss of work, et cetera, related to mental health over the next 3 decades, followed very closely by cardiovascular. So cardiovascular mental health really exerting a huge societal cost from the non-communicable disease perspective, and obviously air pollution contributing to that. So from so many different perspectives, linking evidence of air pollution to mental health is a big issue, and just recognizing the burden on the world from a mortality, morbidity, and cost perspective also very important. Thank you so much.
Thank you, Rajesh. And Samantha, did you want to follow up?
Yes, just to complement, and thanks, Rajesh. Indeed, there is already evidence, but indeed it's a growing research field, the interconnection between air pollution and mental health. The main evidence now is around the cognitive decline and dementia. But there are also studies that are linking particulate matter exposure with increased risk of schizophrenia. Of course, we have to take this into the consideration that there are different grades and levels of evidence for each of these health outcomes. But indeed, generally speaking, there is growing evidence on a strong effect, mostly on cognitive decline and air pollution exposure. So over. And this is in one of the other research agenda gap that is being filled, let's say.
Thank you, Samantha, as well. And since I'm a cardiovascular scientist and I can't keep quiet, I'm also going to point out there's a strong link now between air pollution and dementia through vascular dementia. So the very robust health links between air pollution and cardiovascular disease. And it's been proposed by several very prestigious government organisations that vascular dementia could be through the cardiovascular effects of air pollution, and that could be one of the key ways that air pollution has effects on the brain as well. So this is where we're starting to see how different backgrounds and disciplines need to work together to sort of tackle wider issues, things like dementia, and of course wider further on mental health. Okay, do we have any further questions? I can sneak one in. We have 2 minutes. If you quickly raise your hand, I'll try and sneak it in. Otherwise, I might just be tempted to start the next session a little bit earlier. Okay, I don't see any hands. We do have another 10 minutes for question and answers at the end of the next session, particularly to the speakers who are about to follow me, but do feel free to ask more wider questions as well and add them to the Q&A chat. So I think I'll just close the Q&A session for now, and I'll hand back over to Gloria to introduce the next few speakers. Thank you.
Thank you, Dr. Miller. Great enriching dialogue. And I loved our colleague from Guyana. Thank you for reaching out. It really also makes me feel so happy that also this medium is bringing people together and increasing the communication links among us, among entities. Thank you very much for that intervention. And thank you so much, Dr. Miller, for coordinating this session. Yes, now we move on to our next presenter. We have with us Kelsey Armstrong Wallensack, and also, please forgive me if I mispronounced, who has been with the World Heart Federation's advocacy and policy team since 2019. She advocates for evidence-based cardiovascular health policies at the global level and has been instrumental in putting this webinar together. Thank you so much, Kelsey, and welcome.
Thank you so much for having me. I'm delighted to be here. Good morning, good afternoon to everyone. We've had some amazing presentations so far, and I'm going to do my best not to take up too much time or too much repetition since we've heard some great data. But what I'm here to do is present a little bit from the point of view of the global cardiovascular health community about what's been done and what can be done in terms of air pollution action in the CVD space. So we're going to be presenting one of the tools which Dr. Mark Miller has introduced earlier, and ways that maybe this can be useful and hopefully answer some of those questions I saw in the Q&A and chat earlier about, well, you know, this is all great, but what can I do? So just a quick little bit of background about the World Heart Federation. We're committed to reducing the impact of air pollution on heart health. This has been a priority for us since 2018 when we participated in the first WHO high-level meeting on air pollution and health. And we're guided by our air pollution and climate change expert group, the chair of which is Dr. Mark Miller. And I know some of the members are also here in the webinar today. So that's another great resource. Hopefully we can get some discussion with them in the chat and online later. But what we're really trying to do is both internally move our community to be more active on air pollution and heart health, and also externally advocate for policies that are going to reduce air pollution and its subsequent effects on cardiovascular health at the global level. So you've seen this before, that it's, you know, an increasing risk for morbidity and mortality globally, higher than LDL cholesterol, which is, you know, a huge impact, and the traditional kind of big four risk factors for cardiovascular disease, the things we look at like physical activity, alcohol, and tobacco use. However, in the global space, you don't often see cardiovascular disease as the kind of obvious connection that people make with air pollution when it comes to health harms. A lot of people immediately think of respiratory diseases, which is, of course, a big issue, but there's been kind of a lack of action in the CVD space. And we hope to address that by providing tools and information like this webinar today to get the CVD community more active, since it is such a huge and indeed growing threat to our health. So this is a graphic that comes out of our air pollution and cardiovascular disease policy brief, which we find really useful. It is available on our website and in the brief. If you feel like you would ever like to make use of it, we encourage that. But this is just kind of a visual representation of how air pollution impacts our cardiovascular health. Because as I said, it's not always so obvious, especially to those outside of, you know, maybe epidemiological spaces, of why is this affecting my heart? Clearly, you know, air goes in my lungs. So we just like to show visually, there's penetration into the lungs, different size of different pollutants, whether it's PM2.5, PM10, microparticles, et cetera, can penetrate to different levels of the lungs and have different impacts. Very often the issue that we're looking at is transfer of those particles into the cardiovascular system. These can have multiple impacts, which you're going to see more about in the next slide. but especially cardiovascular impacts related to arrhythmias of the heart, increased susceptibility to ischemia, constriction of blood vessels, increased blood pressure, and increased coagulation, which are some of the main issues. And as you saw in earlier graphs, almost, I think we're saying now more than half of deaths related to air pollution come from cardiovascular disease if we're combining stroke and ischemic heart disease. So it is massively implicated here. So as I mentioned, it's not just the cardiovascular system, but this is kind of the pathway that we look at from our perspective as the World Heart Federation. Because once those pollutants are in the cardiovascular system, they go out through the rest of the body and implicate all of these other systems. So we try to work very closely in our capacity as a civil society organization with other similar organizations. For example, World Stroke, the NCD Alliance, some that you may be familiar with and have worked with in the past, because we recognize that air pollution is a threat across the NCD agenda. So we try to speak with one voice where we can and make sure that we're recognizing at the global level that this is a huge health challenge across our different spaces. So we don't want to silo this issue, especially since we know that it's going to take a multidisciplinary approach to tackle air pollution. Like so many of the kind of commercial, social, environmental determinants of health, it's not just a health problem. The answers have to come from the interdisciplinary space. So what can we do? That's the big question. I would encourage you, if you have the time, to have a look at our policy brief, which gets a bit more technical and concrete, but I'm not going to, read every single recommendation to you now. But I will say that we have divided it up into different kind of areas that we're targeting and different types of actions that can be taken by people in different roles. So we have a list of interventions you can make at the patient level, which is very much complemented by the toolkit that was presented by Samantha and Rajesh. So if you're a physician and you're facing a patient, there's a list of things that you can do or say to get that patient more aware and more involved in taking charge of their own health when it comes to exposures to air pollution. So whether that's avoiding high levels by being aware of air pollution monitoring data, like the Breathe Life campaign, using certain measures, changing their cooking. There are lots of different interventions you can take at the individual level if you're a patient-facing physician or healthcare worker. However, that's not where we want to stop, especially as an organization that seeks to engage our community in policy advocacy. So if you're a physician or a healthcare worker, there's a lot you can do at the community engagement level to also increase clean air policies that are going to improve our heart health. So whether that's access to the training materials, one of the really exciting things about the WHO toolkit is that it, as Samantha said, is for training trainers. So not just targeting individuals, but also really disseminating the data and information to wider groups by learning how you can become a trainer. Ways you can get involved in the community by talking about tracking pollution. There are lots of citizen level engagements, as we said, about increasing air quality monitoring. There are, I know, some really interesting small grants through partners that we have, such as the Clean Air Fund, that can be useful. And then there are also city level measures which are gaining popularity, where you'll see a lot of mayors taking charge and implementing city level policies that can really improve air pollution and air quality at the local level. And these are things that, we will continually call for, like encouraging active transport, which has the co-benefits of increasing physical activity as well as reducing emissions. So after looking at the physicians, we also look at our members. So the World Heart Federation is mostly made of scientific societies and foundations, as well as patient advocacy groups. There's a lot that they can do at the national level to advocate for better policies. Again, this can also reach up to the supranational level and regional organizations. I think in places such as the Caribbean, we have members like the Healthy Caribbean Coalition, which are doing really amazing work at that super-regional or supranational level. So regional action can also be especially powerful because we know that air pollution is not limited to national boundaries. It doesn't just stay in your country because that's where we drew the lines on the map. So they can also work to increase the relevance and importance of air pollution on the agendas of their congresses and events, and also include it more often in policies and papers coming out in prominent journals, which help move the needle on scientific interest at the global level. And then we have some specific policies for policymakers. Those who are here representing governments today, ministries of health and environment, we're delighted to have you. As I said, I think I'm not going to go too much over time because there are so many recommendations we can make, but some of the key ones that we do like to highlight, as I mentioned, are the active transport policies, because these are such great win-win measures, where you can see like low emission zones, parking policies, infrastructure for walking and cycling can have this dual benefit of both reducing emissions, improving the air quality, but also improving the overall health of people by encouraging physical activity and fitness. There are also things you can do, such as advisory and monitoring and communicating that information to citizens, both at the local and national level, which can be important, especially in times of increasing climate events such as wildfires. And then at the international level, we have a World Health Assembly coming up. There is a resolution on the table for climate and health, and we certainly encourage national governments to get involved and support those initiatives. And we as civil society are here to help you do that and make sure that the implementation of the WHO air quality guidelines, which were recently updated in 2021, is high on your political agenda. So as we've said, there's a lot of gaps that need to be filled by research, but there is so much that we already know. We don't want to wait around to take action. So these are just some of the actions that we would encourage you to consider taking. And yeah, we really hope that this platform today will serve as a way for you to connect both with each other as participants, but also with the panelists and the organizations hosting the webinar to start implementing some of those solutions. And yeah, really happy to come back in the Q&A section to address any specific questions you may have on this. Thanks so much.
Thanks so much, Kelsey. And that was, thank you for also giving us the civil society, scientific society perspective. And it really shows the complementarity that we have been building among the three organizations. So thank you very much. So now we move on to our next speaker, our very own, Dr. Juan Castillo, who is our air quality and health advisor. And he will be speaking about opportunities for action. Juan is an environmental health specialist experienced in assessing health impacts of air pollution and climate change to support environmental policy development and decision-making. Juan focuses on using state-of-the-art research and evidence to build capacities among countries and city-level government in our region. Thank you, Juan. Please go ahead.
Thank you, Gloria. We are really excited about this conversation. You see this event happening today, but it has taken us a lot of coordination to make sure that we can have the right audience and have the best speakers and deliver the best of our technical cooperation on this conversation of like putting together these two communities, or these different communities, like from the environmental sector and from the health sector, but specifically for the non-communicable diseases community, that in areas where we traditionally we weren't working together. So we are excited about that. And we already have some work on the making happening. So I want to give you an overview of how are we approaching to non-communicable diseases to address air pollution as a risk factor for non-communicable diseases. First, I want to mention our technical cooperation on environment, health, and climate change, and health, environment, and climate change. And one thing that we are trying to focus at this time is to put equity at the heart of environmental public health. And we are saying this because it is not just that we want to make sure that that the average are better. We want to make sure that the people living in condition of vulnerability are having access to better resources, that their physicians have access to training that allow them to identify those vulnerabilities and also to address and issue recommendations, such as Kelsey was mentioning before. But also we have a focus on, let's say that we said that 90% of a country has access to clean energy. Okay, we want to make sure that this 10% are usually the people who has increased vulnerabilities because of poverty issues, because of some accessibility issues. Also, we want them to have the chance to enjoy better air quality and better health. So equity is at the heart of our technical cooperation. Actually, our unit is now part of a new brand department that is called the Department of Environmental and Social Determinants for Health Equity, and this is one of the topics that we want to address. So our technical cooperation on air quality and health addresses three main topics: ambient air pollution, household air pollution, and indoor environmental quality, related to the air quality at the interior of buildings, either healthcare facilities or residential or commercial buildings. So this is what we have identified at this time as the main exposure concerns in the region. But then we are also working 5 strategic areas or line of action, like is regulation and governance. Within we have like these interministerial working groups that were mentioned before by our colleague from Guyana, but we want to make sure that this is addressed as a topic that require interministerial cooperation. So we have like these working groups at a country level. It depends on the country, but basically when we are able to incorporate this topic into a technical cooperation agenda of PAHO with the country, we want to make sure also that we are doing this as a joint effort. We have planning and evaluation tools. I'm going to talk a little bit more about that in a minute, but particularly we are using tools to estimate the health co-benefits of improving air quality, because one of the efforts that we are making at this time is to make sure that we are able to have a better health understanding of these micrograms per cubic meter of this concentration, or like these environmental measurements or monitoring, what that they imply for health, and also how a city or a country, how the intervention that a city or the country is implementing can benefit health. And because of that approach, we can like foster or further the impact of those interventions. We, of course, work on surveillance and information systems, talking about epidemiological surveillance, air quality monitoring systems, and we are also making significant efforts to increase the capacity of the technical cooperation on primary care and health response, particularly on training for the health sector, also response to air pollution emergencies that we experience in the region, and we have this component of outreach and capacity building. So how are we integrating NCDs into our quality and health? Building upon what Kelsey was mentioning before, we are talking about city-level interventions, health co-benefit assessment, air quality and health regulatory development, access to clean household energy, as well as capacity building. I want to bring a couple of examples. This one is from Barranquilla in Colombia, talks about health-focused city-level planning. So Barranquilla is a city of 1.3 million inhabitants, a coastal city with high relative humidity and temperature. And they have an ambitious air quality management plan because they also were affected by shipping emissions. They are an industrialized city, so they also have like industry emissions and, of course, transport emissions. So the city, among developing an air quality management plan, they prepare like certain interventions that can have important potential to improve air quality and health. One is a Malecon River Walk. That is a river walk of 5 kilometers that is currently used as a public space where there is a lot of physical activity, a lot of community engagement. They have a project to recover urban park. They have recovered more than 700,000 square meters of urban areas. And they have a Ciénaga de Mallorquín that is an urban wetland. So they are trying to connect the city also with the environment. What are the health gain of those interventions? At least 93% of the population has now access to parks within 5 minutes walking distance. They have 10 million visitors per year, single use, to the city river walk. And they have achieved a reduction of 10% of PM2.5 during the last 5 years. But this is also an opportunity to have health promotion and increase physical activities. So you can see here, like these are pictures. The first one here is about the Malecon, and the one that I'm pointing out now is one of the interventions recovering the urban parks. So you can see that now the city is also using these spaces not just to reduce emission, but also to promote health, to develop health promotion activities, to communicate health activities, and also to incentivize physical activity. So because of that, what we are doing now is like we are using the health impact assessment tool to estimate the benefits of that. So we are using tools as RQ Plus that help us to estimate what are the health gain by increased air quality, where we are using heat that help us to estimate what are the benefits of physical activity, and ReNUR that help us to estimate the benefits of green urban areas. And those are related with the reduction of non-communicable diseases. So this is something that is very relevant for the health sector engagement, and beyond that, for a more collaborative effort between the Ministry of Health, Ministry of Environment, and not just the environmental and health sector, but also the urban development units that are now seeing that how their interventions, we are providing them with tools for them to see how this intervention can benefit health, mitigate climate change, improve air quality, and by doing that, have access, have a better reception from the community, but also to potentially access to more funds to support that implementation. This is an example of Trinidad and Tobago, and I saw that some of our colleagues from the Twine Islands are here, where we work together on preparing an integrated roadmap on air quality, short-lived climate pollutant, and health. Basically, this roadmap tries to address the issue of air pollution in the country, but also to engage with the health sector to develop interventions that achieve multiple benefits in both air quality and health. So this is a collaborative effort that was done with the different regional health authorities, the Ministry of Health, the environmental management authorities, the Central Statistical Office, and we also have the involvement of the University of West Indies, the National Institute of Public Health of Mexico, and we work together with PAHO WHO, the UN Environment Program, and the Climate and Clean Air Coalition. So as a part of the project, we use AirQ+, and we estimate that nearly 600 deaths were attributable to air pollution per year. They were attributable to air pollution in Trinidad and Tobago, even at this concentration that exceed the WHO guidelines. 25 were the most polluting, where the pollution were coming from, where the main emission sources, and using air quality monitoring station and health data, we were able to identify where the population most affected by air pollution was. And the roadmap currently have like 5 lines of action, including regulation, development of infrastructure and technical tools, financing and emission reduction strategies, outreach and capacity building, and monitoring and evaluation. So we have this project going on, and actually currently we are working with Trinidad and Tobago because the country is interested in updated the air pollution rules or air quality rules to provide a more protective levels to the population. Dr. Rajesh also spoke about the use of solid fuel for cooking and heating, and how this could be a factor to an exposure to air pollution and a risk factor for non-communicable diseases. So what we have here in PAHO is what we call the elimination initiative. As you can see, the goal of the elimination initiative is like at least 95% of the region population rely primarily in clean technologies for cooking. And as a region, we have certain countries which more than 20% of the population still relies on polluting fuels. And this is quite peculiar because nowadays we are talking about electric vehicles. Everyone has a cell phone. We are sending missions to the moon again, but still we have people in our countries that are relying on polluting fuel that every time that they want to cook, they need to inhale a lot of pollutants. So we want to bridge that gap, to short that gap. And even in the Caribbean, we have some countries that, according to our data, have like relatively high use of polluting fuels understood as biomass or kerosene. So the elimination initiative is trying to address that, and we are incorporating this into PAHO technical cooperation with each country. We are also making an important effort to support regulatory development. Several countries in the region are making efforts to advance new air quality rules that provides more protection level to the population. In 2021, WHO released a new update of the air quality guidelines with state-of-the-art evidence about the effects of air pollution on health and what would be a concentration that can protect the health of the population. In countries in the Caribbean are also being part of this. And we are using health impact assessment tools to estimate the health impact of air pollution, to promote joint work among the health and environmental sector, intersectorial articulation, to support the regulatory development, because we want to say, okay, we want to update the regulation, but why? What are the health benefits of that? So we are using these health impact assessment estimates to understand what will be the health gains of those interventions and the benefits of incorporating or developing new regulatory standards. It is also a base for evidence for action and help us to strengthen the epidemiological surveillance. And also we are using the data because we make a lot of effort. I mean, your countries make a lot of effort gathering data, health data, air quality data. These tools help us to put it together and use the data that is for decision-making processes. That is one of our goals when we are working on this. We actually have a regional expert group that we are aiming and eager to expand in the Caribbean, because we have seen countries as Trinidad and Tobago, Jamaica, Cuba, now Guyana, that are in a position where they can, and different countries in the region, when there is interest to estimate the impacts of air pollution. We are putting together this trainers approach as well to make sure that that is addressed. And as it was mentioned before, we are doing also outreach and capacity building. We have this training material that is available now in WHO Open Campus site about air pollution and health for the health worker, that is being expanded as well, and that we are working also to adapt for the region. We have the Breathe Life campaign, that is a campaign led by WHO, PAHO, CCAC, and UNEP to help to get through the message about the benefits of integrated action. And we also partner with countries in outreach events or events that help us to raise awareness about this topic, as the International Day of Clean Air for Blue Skies Days. This is an example from Trinidad and Tobago last year when they were presenting the roadmap. And we understand that there is an opportunity for technical cooperation here, and we want to make available the resources for you, for the countries here. So thank you so much for your time. We are coming back to Mark and Lord. Thank you, Mark.
Hello again. Thank you very much, both Kelsey and Haran, for those presentations. I think I said it at the end of the last session as well, but it's so good to now actually see so much action being taken, to have so many initiatives that are ongoing, and it certainly seems like the PAHO region is doing really well at having these initiatives and at a scale which can make a difference. From initiatives such as changing pathways, green space, traffic, to have such a reduction in air pollution in a short space of time is really good. So let me turn to some questions. We are approaching in the last 10 minutes, so we've got about 4 or 5 minutes for some further questions if you have any. So feel free to put your hand up. Please do be brave. Don't be like all my undergraduate teaching I do, and I have all my students sitting there in silence, and it makes me feel really bad that I've given a bad talk. Please do ask that question. We had a wonderful discussion in some of the other regions with people getting very, very passionate about their own activities and what they can do personally. So do feel free to ask that question. Okay, while we think, there were some open questions, I think, just now. Perhaps I'm going to come back to you, Haran, I'm afraid. This relates to what you were talking about. So from Safia has said, are there avenues to actively contribute new research of the growing body of data and advocacy efforts, particularly in Trinidad and Tobago? So you've just spent a bit of time talking about this, but anything specific about contributing to new research and advocacy efforts in that region?
Yeah, absolutely. Thank you, Safia, for your question. And I read also that you are part of the OpenRQ advocates, that I think is a great initiative to make sure that, or to promote that air quality data is available and is actionable. And we believe in public information, and the air quality data should be public so people can be informed. Trinidad and Tobago particularly has this air quality monitoring network, and it's available to the public. So it's a great initiative. We are promoting that as well to make sure or to promote that the citizens can have access to this data, but also that it's paired with health recommendations as well to capacity building processes, so we can better understand, or the citizens can have better tools to understand how that data is available. We already have some conversation with OpenRQ, so we would love to hear more about you working on follow-up conversations, Safia. That would be great, because it's a very important tool that, and actually our expert group on RQ Plus is also including participation from civil society organizations, because this is an effort that will require also work from the Ministry of Health, Ministry of Environment, but the civil society organization. Because the good thing about this air pollution is that, or the good thing or the bad thing, I'm not quite sure, is like every one of us is breathing the same air most of the time. So we are all exposed to this. So we need to be informed and make decisions. Mark, actually, I would like to turn back to you on the question from Cesar about if we are asking the physician of how can we encourage the physicians to ask or to be informed about air pollution. He mentioned about like this 30% of the population of the physician asking about the patients about the air quality issues in their homes. Can you share your thoughts on this?
Yeah, absolutely, and thank you for pointing it out. And Sar suggested that when he's spoke to the clinicians, he was suggesting that less than 30% talk to their patients about air pollution. I think the situation might even be slightly worse. And in the UK, where I speak, I've heard general practitioners or general physicians talking about how much they talk about air pollution, and they give lectures on air pollution to various different academic audiences. And quite often when they do so, I ask them, do you talk to your own patients about it? And actually, it's pretty much always they say, no, they don't. And also, the converse is true, that patients don't specifically ask about air pollution to the doctors. And I think really that's a thing that needs to change. It's a sign that while we do have improving awareness in air pollution, it needs to be better. I mean, I do get emails as a scientist, and I'm certainly not the best person to offer medical advice as a scientist, but I do get emails from people who feel that they have particular health complaints, and it might be due to something, for example, that's happening for some emission in their homes, things like mold in the air, to do with leaving windows open and work being outside and dust coming through the windows. And it's not an easy question to answer. But as Rajesh has just shown, we're now having tailored sort of guidelines to say, this is how you are best to present this to your patient. And it differs in what part of the world you're in. But I don't really have any advice on it other than this is why we need to have more webinars like this. We need to start communicating better with healthcare workers of different types, not just general physicians, with hospital doctors, with nurses, with community nurses, to try and have these discussions. There's no doubt about the science that air pollution is affecting your health and is affecting everyone's health. So the sooner we start having that conversation with the healthcare sector, the better, I would say. Okay, we have a few questions coming in. I'm conscious. I want to pass to Gloria to round up. I don't know if anyone wants to briefly comment just on how can scientists help accelerate policy implementations on air pollution mitigation. Does anyone want to quickly pick up on that? I've declared I'm a scientist, but thank goodness Kelsey's going to answer on my behalf.
Well, maybe not entirely, but I can at least share a few thoughts. I think it's a really important question because, as we've said, for a long time, the call has been for, more data, more research, so that we can know for sure that this is a problem. I think we can all agree after the great presentations today, it is a problem, and now the issue is implementation of policies. So as we move more into implementation science, what can we do to support that implementation? I think a really good way to start, if you are, an individual wanting to get involved in this space, is to decide at what level you'd like to be involved, whether that's at the global level, if you're working in an organization like mine, who is in official relations status with WHO, you can get involved in policy advocacy at forums like the World Health Assembly, which is coming up. If you're not involved in that kind of organization, you can still, as an individual, lobby your government for supporting those kinds of resolutions. So World Health Assembly is the big international policy-making kind of space in the year. It's this May. And you, as a citizen, have a right to talk to your government about policies they should be supporting at the international level. But if that seems like, you know, too big of a place to start, there are a lot of local level policies that you can rally to see implemented, whether that's improving monitoring in your community. There are a lot of great ways you can get involved through the Breathe Life campaign. I think we might have dropped the link to that, but if not, certainly it's available just by Googling Breathe Life. Because the more data we have, the better we can see those policies implemented. Joining community groups to see that there's better infrastructure implemented for physical activity and active transportation is a great way to get involved. And again, if you're in the actual medical space as a physician, talking to your patients, understanding what tools are available for them to monitor their own exposure to air pollution and what individual activities that they can take. So I think there's a huge range, like a menu of ways you can see those policies implemented. I'm going to drop a link to our WHF policy brief, which has a nice table at the back of the document, which kind of shows this menu and lots of different ways to get involved going forward.
Thank you, Kelsey. That's great. Wonderful advice as well. I am going to hand over to Gloria, but just in the corner of my eye, I do see a question popped up in the chat about communicating the health effects without upsetting the economists. The economic modelling has been done. The interventions that will reduce air pollution, you can measure what would be the economic benefits of the improved health. And even if you do the most conservative measurement, sort of calculations for that, and just say what would be the economic benefits of reducing deaths, they far outweigh any of the cost of the interventions. And that's not even including things like the actual effects on morbidity, the effects on mental health, effects on well-being, on lost work days. So there's no doubt about it, reducing the air pollution will be economically beneficial. And of course the green industry is a huge very active area in the economy these days. Okay, I'm just about over time. Gloria, I'm going to hand over to you just to say some goodbye words nicer than I can.
Yes, thank you, Dr. Miller. That was wonderful. Well, first, I want to thank you all for this wonderful, this has been truly a treat. You know, when you learn something new, your mind is expanded, new possibilities of collaboration, and new resources. This will be a step-by-step process. I think especially for our healthcare providers. I'm actually currently connecting from Belize today, where I had the opportunity to visit community health centers and regional hospitals and small hospitals as well. And our providers are busy. They're fully dedicated to their patients. So we know that those that joined us today truly made that effort, and we really appreciate it. I saw many of persons that are part of the Hearts Initiative in the Americas that are implementing the Hearts Initiative that has also had collaborations, of course, with WHO, where Hearts emerged from, as well as with World Heart Federation. So here we are building those bridges. Some have been across those bridges before and many times. Others, like me, are starting to build those bridges. And thank you so much to Juan Jose Castillo for reaching out across interprogrammatic aisles, if you will, and allowing us to have this. Just very quickly, I do want to say that for all the registrants, you will be getting the follow-up, the recording of the session, as well as the as well as slides that were presented. So please stay tuned for that follow-up. We also like to have other webinar sessions. So yes, stay tuned for a continuing series of webinars for the upcoming release of the materials that were shared today. And for all of our colleagues in the region, we had a diversity, not only from the Americas, from Africa and other latitudes, and for those in the region of the Americas, for Spanish-speaking colleagues, there will be materials produced in Spanish very soon, and also a webinar as well. So I think, Juan Jose, please feel free to fill us in. I mean, people have been wonderful spending the Friday morning with us. Friday morning in the Caribbean, very close to starting a weekend. So we are very appreciative, and thank you again. Juan, I don't know if you wanted to say anything else that I might have missed, and it was a pleasure to work with all of you, and to all of our participants, a very big thank you.
No, Gloria, that's fantastic. Thank you for your summary, and thank you, Mark, also for your great moderation on the panels. We love the session. We will send also this information to the country offices so they can keep up to date. And I will say that this will be a good opportunity also to inform our director departments, so they are both the environmental determinants of health and non-communicable diseases, to foster this cooperation. Thank you.
Thank you. Have a great weekend. Take care. Bye-bye.
Thank you.
Thanks,
Bye.
everyone.
Bye, everybody.
Thank you.